Many men, as they get a little older, start noticing things aren't quite the same down there. Maybe achieving an erection takes a little longer, or maybe it doesn't feel as firm as it used to, or perhaps it's just harder to maintain. This can be incredibly frustrating, even worrying. You might blame it on age, or stress, or diet, and those things certainly play a role. But often there's something else, something many men do regularly, almost automatically, without ever thinking it could be causing harm. It's a common practice, something private, and because of that, it's rarely discussed, even with a doctor. What if I told you that for some men, the very act they turn to for pleasure or release could be silently undermining their body's ability to get hard? It's true. And as a surgeon who works in this sensitive area, I've seen the effects. It's a mistake in technique during masturbation, a habit formed over years that, while seemingly harmless, can cause subtle damage over time. This isn't about shame. It's about understanding your body and protecting its function. In this video, we're going to uncover this specific mistake and explain exactly how it can impact your erectile health. We'll look at the physical toll it can take and why it might be contributing to difficulties you're experiencing. Watch to the end for something that will surprise you. Now let's talk about this specific action, this mistake, that can cause problems. It often boils down to one key factor: excessive force or an unnatural technique. Think about the delicate structures involved in getting an erection: blood vessels, nerves, and specialized tissues all working together. They're robust, yes, but they're not invincible, especially when subjected to consistent, unnatural stress. The issue often arises from a masturbation technique that involves repetitive, vigorous gripping or downward pressure on the shaft of the penis, particularly near the base or in the middle. This isn't about masturbation itself being harmful. It's a perfectly normal and healthy activity. The problem lies in how it's sometimes done, often aggressively, perhaps mimicking certain actions seen in pornography, or simply developed as a personal habit over decades without any awareness of the potential long-term effects. When you apply excessive pressure, squeezing hard with your hand, you can potentially compress or stretch the tiny blood vessels and nerves that supply the penis. Imagine squeezing a garden hose repeatedly in the same spot. Over time, you might weaken the hose or restrict the flow of water. Similarly, chronic, excessive external pressure can affect the internal structures responsible for filling with blood during an erection. The tunica albuginea, the tough, fibrous sheath that surrounds the erectile tissue and traps blood during an erection, can also be subjected to undue stress. While robust, this layer can potentially be affected by prolonged, focused pressure. More commonly, the nerves, which are crucial for transmitting the signals from the brain and local stimulation that initiate and maintain an erection, can be compressed or desensitized over time. Think about if you press hard on your arm for a while. It might go numb or tingle. Now imagine that pressure, perhaps less intense but repetitive, applied daily or even several times a week. For years, the small nerves responsible for sensation and signaling blood flow can become less efficient, leading to reduced sensitivity or impaired nerve function. This isn't necessarily instantaneous damage. It's often a slow, cumulative process. You might not notice anything wrong at first. In fact, the very act might feel intensely pleasurable, reinforcing the habit. But beneath the surface, subtle changes can be happening. Maybe the glans feels a little less sensitive over time, or perhaps the quality of erections gradually diminishes. The consistency of the pressure is key here. If you repeatedly apply the same strong grip in the same area, you're creating a localized stress point. Contrast this with natural stimulation during intercourse, which is typically more varied in pressure and movement. The artificial environment of manual masturbation, especially with excessive or unnatural force, can put a different kind of strain on the anatomy. Another aspect is the speed and intensity. While there's nothing inherently wrong with vigorous activity, combining high speed with excessive grip force is where the risk increases. The repetitive friction combined with strong pressure can also affect the skin and underlying tissues, potentially leading to microscopic scar tissue formation over very long periods. Although this is less common as a primary cause of significant erectile dysfunction directly from masturbation alone compared to nerve and vascular issues from compression. The critical point is the chronic nature of the stress. A one-off instance isn't likely to cause lasting harm, but a habit practiced consistently over many years, from younger adulthood right through to older age, can lead to changes that become more apparent when other age-related factors, like vascular health changes, diabetes, or high blood pressure also start to play a role. It's like continually rubbing a rope in one spot. Eventually, the fibers start to fray. In the context of erectile function, this fraying manifests as a decline in the firmness or reliability of erections. It's a silent process because there isn't usually sudden pain or acute injury. It's a gradual wearing down or desensitization, making the tissues and nerves less responsive to the signals required for a strong erection. So, the mistake often isn't masturbating, but how? Using excessive focused, downward pressure and grip force repeatedly over time. Now that we've explored the fundamental mistake and how it can begin to affect the delicate structures involved in erection, let's delve deeper into the longer-term consequences and related factors. As this habit of using excessive force continues over months and years, the initial subtle effects we discussed, maybe a slight decrease in sensitivity or a feeling that erections aren't quite as robust as they once were, can start to become more pronounced. The cumulative stress on those small blood vessels and nerves can lead to more significant functional impairment. Imagine those tiny blood vessels becoming less elastic or slightly narrowed due to repeated compression, making it harder for sufficient blood to flow into the erectile tissues when needed. Similarly, if the nerves become less effective at transmitting signals, the erection reflex itself can be weakened. This isn't just about physical damage, it can also have psychological effects, as erections become less reliable. Anxiety around sexual performance can increase. This performance anxiety, in turn, can further exacerbate erectile difficulties, creating a frustrating cycle. You might start worrying before intimacy, which floods your body with adrenaline, a hormone that actually works against achieving an erection. So, what might have started as a purely physical issue stemming from a masturbation technique can develop into a complex problem with both physical and psychological roots. Furthermore, this issue doesn't exist in a vacuum. As men age, other health conditions become more common, many of which already impact vascular and nerve health, the very systems affected by this masturbation technique. Conditions like diabetes, high blood pressure, high cholesterol, and heart disease all compromise blood flow and nerve function throughout the body, including to the penis. If you already have some underlying issues with your vascular system due to these conditions, adding the chronic stress from an aggressive masturbation technique can accelerate the decline in erectile function. It's like putting extra strain on a system that's already under pressure. Lifestyle factors also play a significant role and can amplify the impact of this habit. Smoking, for example, severely damages blood vessels. Combine that with repetitive compression from technique, and you're hitting those vessels from two different angles. Lack of exercise contributes to poor circulation and overall vascular health, making it harder for your body to compensate for any damage caused by external pressure. Poor diet leading to weight gain, particularly around the abdomen. And conditions like insulin resistance can also negatively impact blood flow and hormone balance, further complicating matters. Stress, both physical and emotional, also takes its toll. High stress levels can interfere with the hormonal signals necessary for erection and increase muscle tension, neither of which is conducive to good erectile function. So, while the specific masturbation technique might be a silent, underlying cause, it's often the combination of this habit with age-related changes and other lifestyle or health issues that brings the problem to the forefront. It reaches a tipping point where your body can no longer compensate for the accumulated stress and damage. Recognizing this connection is the first step towards addressing it. It's not about blaming yourself. It's about understanding the mechanics of your body and how everyday habits, even private ones, can have long-term consequences. The good news is that, in many cases, making changes can lead to improvements. It might involve modifying the masturbation technique itself, opting for less forceful pressure, perhaps using lubrication to reduce friction, and allowing for gentler stimulation. It might also involve addressing the related health and lifestyle factors we discussed, improving diet, getting regular exercise, managing stress, and working with your doctor to control conditions like diabetes or high blood pressure are all crucial steps that can support better erectile health, potentially allowing the body to heal or compensate for past stress caused by technique. It's about taking a holistic approach to your sexual health, recognizing that it's interconnected with your overall well-being. Now that we've explored the deeper implications and related factors, let's bring it all together and talk about what you can do moving forward. So, we've talked about a mistake many men might be making without even realizing it, using excessive force or an unnatural, focused grip during masturbation, particularly over many years. We've seen how this can put undue stress on the delicate blood vessels and nerves essential for getting and maintaining a strong erection, leading to a gradual, silent decline in function. We've also discussed how this issue is often compounded by other age-related changes and lifestyle factors like diet, exercise, smoking, and underlying health conditions. It's a complex picture, but understanding the potential link between this habit and erectile difficulties is powerful because it gives you a starting point for making positive changes. Remember, the goal here isn't to stop a normal activity, but to ensure it's done in a way that supports your long-term sexual health. Think about modifying your technique, using less pressure, focusing on gentler stimulation, perhaps varying the method or using lubrication to reduce friction if needed. It's about being kind to your body's tissues and nerves. For some men, simply changing this habit can lead to noticeable improvements over time, allowing the body a chance to recover. But it's also vital to address the other pieces of the puzzle. Taking control of your overall health is paramount. That means eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, foods that support good circulation and overall vitality. It means incorporating regular physical activity into your routine. Exercise is incredibly beneficial for vascular health and stress reduction. If you smoke, seeking help to quit is one of the single best things you can do for your circulation and erectile function. If you have conditions like diabetes, high blood pressure, or high cholesterol, working closely with your doctor to manage these effectively is critical. These are all interconnected. Improving one area of your health often has positive ripple effects on others, including your sexual health. Don't hesitate to talk to your doctor if you're experiencing persistent difficulties with erections. They can help identify underlying medical causes and discuss potential treatments or strategies, including addressing habits like the one we've discussed. Sometimes, simply acknowledging the issue and seeking help is a massive step forward. This journey is about empowerment, understanding your body, identifying potential challenges, and taking proactive steps to maintain or improve your quality of life. It's about recognizing that sexual health is an important part of aging well, and that issues are often manageable. Small, consistent changes to habits and lifestyle can truly make a significant difference in how you feel and function. Don't underestimate the power of modifying a long-held habit and combining it with broader health improvements. It's never too late to start making these changes. Remember, you're not alone in experiencing these challenges, and there are steps you can take to improve things, sharing your thoughts or perhaps experiences you're comfortable discussing. Maybe about lifestyle changes that have helped you. In the comments below could be helpful for others watching. Please consider giving this video a like if you found this information valuable, as it helps us reach more people who might benefit. And subscribe to the channel for more insights and practical advice on living your best life at every age. It's about staying informed, staying proactive, and staying hopeful. Live your best life at every age.